What a wonderful set of people to be talking about this topic. Lots of interest and lots of different ways to understand this model. So what we're going to do is get into the some questions, and the first question has to do with collaboration. The idea that you've got data scientists and clinicians and patients and policymakers all wrapped up in often, at least in these initiatives, and there are going to be gaps. There are going to be barriers to overcome this collaboration. So what I would maybe start with you, Sheazin, is just to talk a little bit about what are some of those gaps, and then name maybe one thing you can make a significant difference on in meeting this challenge. What's helped you to go so forward with 40 different initiatives going forward? That's a lot to get going, and 12 already delivered. How do you do that? So what are the things you have to overcome?
Yeah, I think so. I talked about our analytics management framework. So it's first the operating model and understanding in your environment, the roles and responsibilities of the different stakeholder. I'll say digital literacy, AI literacy goes part and parcel. So there's training happening in real time. So for example, with our estimated date of discharge or our AVA model, and all of our models, I will say that there's a learning that goes on in real time. So that's something that you learn and you adjust. So you have to learn in real time that this worked for the clinician, it didn't. And we have an AI playbook. So what we do is actually these learnings come back into our AI playbook. And so we do like this bias for action or progress over perfection, except where it comes to our regulatory or our adherence to responsible AI. That's also part of our playbook. But there is learnings that happen there. So I think having a clarity in terms of what that learning or dialogue partnership looks like. When it comes to the policymakers, I think, we're still learning. So, I won't say it's a barrier, I think it's an opportunity. And when we look at call it the innovation ecosystem model, which exists like in Singapore, Silicon Valley, the UK, these are innovation hubs. And when you look at them, there's really clear model in terms of how different individuals or stakeholders, or whether it's academia, government, entrepreneurs, funders, I'll say corporate, but in our instance, healthcare institutions actually participate together in an effective way. And it does generate some competition, but it's healthy competition. But I think that ability to know your roles, responsibilities to enable that innovation and that AI, I think that's a huge opportunity for us in the British Columbia and the Canadian health space. I think we're all trying to figure out our roles, and sometimes it creates experiences of friction or confusion. But I think it's an opportunity. I do believe we'll get there as we go through our journey.
I think for sure these things are new, so it's we're not going to have all the structures in place to be able to do it. And I really love the fact that you're experimenting and doing work in those areas. So Oz, maybe you could talk a little bit about, you're a data scientist from background. When it works well, what's happening in communication collaboration? How do you get it so that people trust each other and are able to move faster through these complicated sets of processes and systems? You have to
Yes, unmute. So I mean, like, I think I kind of alluded to my past experience in the sense that like it was like data analytics and AI was always like taught as technology driven or technical person driven. And the minute like you treat it as just, hey, like it's just one small project and to be innovative, it didn't work out. One lesson learned from any actual healthcare technology related healthcare project that I learned is you need to get clinicians and policymakers in line before you actually do anything. Like we live this in our CIS application or implementations and anything. And AI is not different, in my opinion. Like, and two other things, like we also ask, like I don't want to put, for example, the blame on us not involving the clinicians or policymakers. They're trying to do this off the side of their desks too. Like we need to create space and availability for them to actually focus on this. And maybe Sheazin was trying to go there, like by having the innovation hub and labs and whatnot to create some dedicated time, space, and like so that this actually happens purposefully. It is not off the side of our desks. And eventually everything comes to, I think, effective communication and storytelling. We need to tell them, whomever is not involved today, what is in it for them, what is in it for the system. It's all that sales pitch so to get the buy-in.
Yeah, I think that's seems to be a common message. Brian, I'd love to hear your thoughts about what is the it's not magic. It's a lot of hard work actually from systems, but I'd love to hear what you think are the most important things we could focus on as leaders in healthcare.
Yeah, for sure. So I think about this maybe from a top-down kind of approach in that I think that we collectively and provincially or across Canada need to decide what is our direction in AI. How far in do we want to go? How readily do we want to adopt this? I think that would really help then create alignment as you move down. A lot of what I've seen at the policy making is deflect, defer, defend, not how do we embrace, how do we actually like maximize this? And I really think what's getting people focused right now is the budget and the productivity challenges that we are facing. And the natural place that you look is technology and especially AI as a possible path forward. So my hope is that we kind of bake in from the start an intention to embrace and use. You asked me about this one thing that we need. Really, for me, it's courage and understanding. In healthcare, we kill things we don't understand, and people are scared. They're scared. What's it going to mean to me, my job, or I don't know how to do this. And I guess really people need to step into it. They need to take responsibility on themselves to learn how to use AI and what it can do and what it can do safely, so that fear goes down, and then they can embrace the journey that we need to get on.
That actually addresses some of the questions that people are asking inside the Q&A as well. Brian, how do we get through these challenges? What do we need? So great answers. I really appreciate it. Actually, we're hitting a lot of the concerns I'm seeing inside the Q&A. But one of the concerns that I think has jumped out of the Q&A as well is this kind of ethical privacy policy challenges. So there are, of course, concerns regarding patient data safety as well as when you're incorporating AI solutions into systems of care. But there's other things that unintended biases, how we bake those in sometimes into algorithms and how these things can be affecting different peoples in different ways. So I guess the question I would start with, and maybe if you don't mind, I'll start with Brian and go back the other way, which is how concerned are you with patient data security and ensuring equitable healthcare outcomes? You're CFO as well as head of technology, and how are we doing in regards to balancing the innovation and also the risks that come along with it? So I'd love to hear your thoughts.
Yeah, sure. No, I'm going to split the two, like the equity piece, and maybe just the part that I believe strongly in is that the use of AI really is about expanding access. So when we think about a geographic equity, the use of things like Gen AI agents to actually engage and check in and provide answers in more rural, remote communities, I think is a way to lift the equity. I think in terms of like the concern, I look at our journey to where we are today. So at Ventures, what we've created is we've created a data lab in the cloud. We did this because we were doing a lot of one-off inquiry, one-off find the data, and not a repeatable process. So we've created this, we call it IHID, our Informatics Health Information Database, and it allows us to have a repeatable process with like documented procedures. REB, the research ethics components of it are well understood because we're using a repeatable framework, a repeatable platform. And I think that's one of the key ways. So you have to bake in the right checks and balances. Things like Indigenous data governance as well. You can bake into a very systemized, anti-bias program, and then repeat, use the same, and build from there.
So the documentation and the way you approach it, processes allow you to kind of build in that care and sensitivity.
Yeah, I think it comes from maybe my business background, which is like, well, let's build a process, and it's to deliver service and deliver service at an SLA, not, hey, we'll get back to you. So it has to be, structured and efficient.
Yeah, that makes some sense. Ozge, how you found the issues in regards to ethical and privacy concerns as you're doing systems?
Yeah, I mean, like it is top one concern in almost all of our clients at this moment. And I don't know, like if you guys like read the you all know Harari's nexus, but one of the gist of Harari cautions, he cautions against viewing AI as neutral or benevolent or urging careful, and he's urging careful like governance to mitigate risks associated with its rise. And whether that's like, data security or bias, and there's many other dimensions actually we need to think about. We need a strong governance structure. Like, I don't know whether, some statistics, I think we're ranking top 10 in a bad way in cyber attacks. And this is all overall Canada. I don't think this is like healthcare. But like in terms of cyber attacks, we are top 10, unfortunately. And especially now that we have Gen AI, API as a service, and adversarial AI, this problem will amplify. I mean, we have solutions? I don't think like there's a silver bullet solution, honestly. We have frameworks, we have processes, and I think to Brian's point, like that's the start. Like we need to establish the frameworks, processes, and whatnot. But maybe to Brian's an earlier comment that he made, I think it always stops at the people. Like if we train people and so that they actually bought into the process, that they bought into not being enforced, but like themselves actually doing the right things, I think good things will happen in general.
Yeah, I think that makes a lot of sense. And then Sheazin, you've got a train of initiatives going forward. You must have inside that some way of handling the ethics and privacy concerns across all those things. I'd love to hear what you're doing.
Yeah, so I think very similar to what Brian has shared in terms of how they adhere to these areas, and Ozge as well, is again, we have our privacy, security, AI risk assessments. We go through a lot of rigor before we actually even develop anything. It goes to legal. It's a very comprehensive and rigorous process. We have a lab as well. And we also, if even before it's deployed, our experts are testing in the lab. We're not deploying anything, and we're testing for some of these biases. Once we deploy, we're continuously auditing and looking for those biases also that could show up. We also have our Indigenous governance in there as well. And so really, there's drifts and there's treatment and, resource allocation. There is technical things that happen with AI. So this is part of the MLOps best practices that we're also establishing. And we really, as healthcare, we need to implement real-time access and monitoring and have these anomaly detections to flag any unusual data access patterns or mitigate breaches. We actually need to bring in teams, I think, as well, that will proactively look at adversarial testing against AI models before they're deployed. So really ensuring those vulnerabilities are addressed proactively and then also monitored after that deployment. So there is a lot that happens in the space, and it's quite complicated. I know from the space we're in. And then sometimes we learn and rules change or something comes up and we adhere to that. So we have to pivot quite quickly in terms of some of these changing environments we're working in.
Yeah, I think that's some of the complication that comes with AI that maybe people don't realize, but the notion of auditing now is becoming a very important component of that. And there's down in the US, they're worried about legal requirements and other things, with built-in biases and systems. So, and it's moving here to Canada as well. So I think these are really important things for any healthcare leader to understand and build into the systems, that there's audits about this kind of information and about whether biases are there or not there. And hard to tell when you're working with large systems. So another aspect, our last question before we get to the audience is, we're moving forward with these AI tools in healthcare on many fronts. People are attending this seminar. They're probably trying to find out more about how they can lead with AI tools and the cautions and also the hopes and the courage that they need, as Brian mentioned. But given this context, what strategies have you experienced that healthcare leaders can employ to promote the successful adoption? So, we've learned a little bit about what isn't successful, but, what might help the people on this call and this webinar who are working with these changes? What advice do you have for moving successfully forward? So maybe I'll start with you, Oz, and then I'll go to Sheazin and Brian, and end up with Brian.
Yeah, I mean, like I'll maybe like give the consulting lingo, but like we generally have a clear like step 1, step 2, step 3 kind of a thing, right? And it always starts with a clear vision, strategy, and roadmap. And like I think several times we said this, like if you don't have the buy-in, we don't get the adoption. And establishing that vision and communicating that vision, strategy, and roadmap is key. And once you have it, you still need to secure the buy-in. Like the people do not come to you. It's a push model generally. You need to change the people's mind first, and that's the data literacy I think, Sheazin, you talked about at one point. And comes the other tangibles like secure the resources, people, and money. I mentioned that availability is the one of the killers. And you make AI as a off the side of your the desk thing, and then showing the value early in the game. Like this is not just about having the roadmaps and strategy, but like doing this tangible and be innovative. I think Brian talked about venture and how like they split the innovation arm and give permission to fail. And like I think the organizations who give the permission to fail succeed faster.
That's great. Sheazin, what are you doing in your organization in regards to strategies for success?
So I think some of what Ozge's already covered. What we do is we know kind of the I'll say the long game or the future strategy. And so we look at the long game, but we also keep our eyes on what's emerging in industry. We're constantly studying and keeping ourselves up with where things are going in this space. And then we play a short game. So our strategic short game is to have this bias for action or our progress over perfection. So we're building. And as we do this, we use agile, or we're using innovation loop approaches today, where we're actually experimenting, catching the risks. What we're finding is our clinicians actually enjoy that more than sitting in long meetings and governance and steering. Like we hear the term, executive steering, and we kind of go, oh, they want to build, they want to play, it's in the lab, it's safe. So that experimental mindset is really great. The grassroots is actually asking for it. There's many grassroots clinicians who are studying in this space. So I think the space of studying and learning and the DAO program is an amazing example of that. We've had many staff go through it and we've seen some changes. So I think it's this mindset shift of traditional to modern ways of thinking and doing things. And you got to have the right talents. And so we've developed the talents over the years. I get questioned all the time, and we're spending a lot of money. We actually took what we had and we've iteratively reorged. And so we kind of ask the question, do we keep doing the descriptive stuff, or do we push ourselves to the top right quadrant of these advanced solutions which have a higher impact? So we need to calibrate in that space continuously, and you definitely need to stop doing some things in order to do some of this and bring in the right talents and have that right partnerships as well who have this talent. So those are kind of some key areas that we have focused on to help us accelerate in this space.
Makes a lot of sense. I see a lot of agility, continuous improvement, just a way of approaching the change that I think encourages a lot of movement. So Brian, I'd love to hear your thoughts on the strategies for success and what's important to you.
Sure. I think I'd like to oversimplify it and ask people, how do you verify that the student that you're teaching has provided you good input? You're working with an AI, it's not a lot different. How do you trust the surgical robot? How do you know that it's actually not going to make a mistake? Like, how do you get comfortable with a new lab test? How do you know that it's right? And so people still need to have that curiosity and actually like have their mind on like evaluating the result. I search in Google and I'm like, does that make sense? Like now there's an AI interpretation of what I'm asking, and I'm like, no, that's not it. You have to be engaged. So I think it is like that simple adoption level. The other piece that I think is, I think it's important is the governance, right? And so the key point I'd make there is it's not just about you approve a technology for use. You have to look at how that technology is being used. So there's a use case piece. So you actually have to approve each one. So imagine, Copilot is approved in your organization. It comes with your Microsoft suite. Great. Well, don't start asking it medical questions to like, what should I prescribe this patient? Probably not the right use case. Technology is approved, but is the right use case? So I think that's part of it. And I think other tools, like as we get into this and we get into the later adoption challenges or the queries, like why did you do this, is you need to expose the explainability of the AI. Why was this decision made? Yeah, is it a statistical score? Is it a threshold score? Is it an A or B score? What is it? So that I, as a user, can actually go, okay, now I actually understand what you did. I don't just, black box, get the answer and hope. So those are some things that we're thinking about.
That's great. Now, there's a lot of questions that are emerging, but before we get into the Q&A session, I just want to take just a minute or two to just introduce what we're doing inside Fraser University, just in regards to our work towards capacity building in healthcare and AI and helping people develop their leadership in this area. So first thing for you to know about us is that we've been around for a while and we've been working with a lot of people. So if you take a look, 22 years, lots of long, impactful relationships with people in healthcare, as you can see by the organization that we've worked with. And I think one of our shining examples is the Family Practices Services Committee Leadership Program, which is a customized program in partnership with the FPSC over the last 15 years that supports primary care redesign in BC. And we're really proud that we've got over 400 alumni, physicians, and nurse practitioners who've gone through this program, just supporting their leadership development. And, an important addition to this work is the work that we've done in our DAO programming. So in our DAO programming, we've done 700 or more than 700 individuals. We've worked with 200 organizations. There's been about a $19 million investment supported by a digital supercluster and digital. And we've seen, about 10% of these participants in the DAO program have been healthcare leaders. And so all told, when you look at all the programming we've done around clinical leads, we've supported over 1,100 clinical leaders in customized programming. And our open programming, about 10% of the people who are coming into that are also from healthcare. So it's an important component of the way we work. I think what we want to do is recognize that we've been doing this digital transformation management, digital transformation leadership. And what we found is that over time, there has been more and more of these organizations coming to us and talking about AI. We're thinking about new programming. So our work on digital technology is basically showing a need to further develop leaders and help them better understand what are the capabilities of generative AI primarily, but other AI components as well. How we can help them to think beyond the technology to connect that vision, to people power, and how with the goal of really supporting leaders to empower, to innovate, and to transform systems of care. So we are bringing 8 faculty members along with an experienced set of practitioners who working together to try to create a program that's going to support leaders in this AI empower leadership area. And together, we're trying to make a significant capacity kind of investment. So building capacity around AI for Canadian healthcare, that's our priority. And we're interested in working together with leaders to strengthen that healthcare. And that's what we're working towards. So if you're interested in working with us, please reach out and we'd be very happy to make impact and talk together and see if there's something we can do together. So just wanted to let you know, for us as a publicly funded Canadian university, we're interested in lending our strengths to experience to support healthcare leaders. And we'd love to be able to talk to you about that. So thank you for your patience. And now I'm going to get into the first questions that we're getting from the audience. So the first question is, there seems to be a trend in healthcare to start working harder with less. I think actually we mentioned it here, which is a little bit unfortunate. The question is how can we encourage senior executives to also embrace AI technology to work not just more efficiently, but also to be focused on benefits? I think what I'm hearing from healthcare workers, they want to spend more time with their patients. They want to be able to provide those benefits to the people they're serving. And it's not always about how fast that happens or whatever, but I'm wondering if we could extend that beyond just doing more with less. And so if you don't mind, maybe Brian, I'll start with you and then we'll hear from others.
Yeah, I think, I alluded to this. I think that there is opportunity in the environment as it is being tightened. I'm unfortunately going to spoil the party, which is, I think for your AI project to be successful, it needs to actually reduce cost and it needs to actually reduce time, or it needs to eliminate a step that has real cost attached to it. I do think that we will get into that benefit zone, but if you look at where we are, we need to focus on things that are actually going to move the needle financially to start. And then, and I would encourage people to think, okay, if I get that in and that's my way in, how do I then build on top of that? And how do I, know that more is going to come later? but I have to validate that I can actually reduce costs, reduce time, reduce manual effort as kind of a fundamental to play in the next year.
Well, that makes sense. Sheazin, I know you're doing this, so I'd love to hear your thoughts about the more with less. You're doing a lot.
Yeah, I'll echo Brian as well. We do need to look at that value of the AI. And I think we need to do a better job on showing the ROI related to it, whether it's reducing administrative or cognitive burden and allowing the clinician to go back to the bedside. I talked about the estimated date of discharge. Well, before they used to look at the whole hospital to figure out where the discharge patients are. Now it's, it guides them to do that. I think there's administrative areas that we can do that. There's clinical areas that we do that as well when we go after quality of care. Again, it's not making a decision. It's not replacing the clinician. It's really a guide, and the human in the loop, many of you have heard that term, is there. And so if you do lay a lens on the patient, it doesn't make sense to do something with them, you won't. But the patient safety areas where you can predict something and kind of guide where they may want to focus in terms of preventing a hospital harm or a unfortunate, we have a mortality predictive model that's being developed. Like, these are things that can help reduce the demand on the system because of quality of care issues. And again, allow the system to go through, but allows the clinician to also more appropriately care for the patient. So those are some areas that we look at. And again, there is ROIs attached to that if we can do that.
Sounds like there's a reality to this equation. Appreciate Brian and Sheazin, you providing it. Ozge, you have anything to add to that discussion?
Yeah, I think like Brian and Sheazin already covered like how AI can help doing more with less. I'll maybe touch on like how together we can do more on AI with less. So this is another sector, but in a tourism sector, like we actually get multiple organizations share resources in order to have one technology platform, have share resources, share code, share algorithms, so that we can expedite innovation, expedite the adoption of AI and impact of AI. So like, I think that collaboration among the organizations, and I'm sure that it's happening. I think that there's room for improvement though. Like, I think it's key.
Yeah, I think I agree. So it sounds like there's a lot of agreement about that kind of element, and understanding that there are constraints, budgets, and others that we have to live through. I'm also, there's so many different facets of AI, but maybe we could take just a look at the patient kind of perspective. So how do we increase patients' understanding? This comes from our Q&A of AI to increase their level of comfort with the use of AI in day-to-day health activities, and what kind of knowledge translation efforts, or maybe we could start with the Fraser Health, are you using at Fraser Health so the patients are more comfortable with this notion? So Sheazin, maybe start with you.
Yeah, so we have our digital front door, which is a digital twin. It's a care navigator. If you go there, it's Fraser. I know somebody said that they're all women names. It's actually Fraser's and it. And so Fraser will help navigate. And so we're building on this digital twin navigator. And we did have patients involved in consulting around this. I think as society learns and they're going to start to expect it, we're not quite there yet. So I think there is, education on the websites. There's education through various patient streams or partnerships that we have that will inform our AI development, but also I think help inform how to use it. I think they start to play with it. I think some people may also actually already expect it to be there. And so I think we're kind of in this mixed zone right now in terms of the different spaces, different areas of the population may be ready to engage with the AI solutions from a patient perspective.
Yeah, some heavily, some not so heavily. So yeah, I can imagine that's the case. Brian, do you have similar things in Providence, or what are you finding?
Yeah, I mean, I kind of think of kind of to be helpful. I think the doctors of BC have a good consent example. And I've experienced that. Like, my family physician was like super upfront. She was like, hey, I'm trying out 3 different scribes. This is the one I'm trying this week. Here's what it does. Here's what it doesn't do. And then we had like a nice dialogue about how it was helping her. And so I think like that, really being transparent, like not trying to be like, hey, I'm super smart. And I came up with all this on my own, being like, hey, I'm using AI, and that's okay. The other thing I've done is like, even like in a briefing note that I used AI to write, I put, the author, I put, well, AI. And, I approved it, but I didn't write it. I didn't write the majority of it. And so again, that transparency and helping people see that it is just part of the equation.
Yeah, I think that's a really great way of thinking about it. And I love the example. Right? I'm trying three to see what happens. So, Oz, what do you find? I mean, you come from a data scientist background. Do you think about the patients, or is that too far from the data?
No, not quite. Actually, there's an example where kind of like the project didn't succeed as much as it should because of the lack of engagement with patients. It was we tried to predict frailty, and like we actually work with the physicians, and we actually captured everything that like they think that's factors like predictors of the frailty and all. But we didn't engage the patients to say, hey, what will you consent to give?
There you go.
And all of a sudden, like we have a model, but like whenever the seniors come through the ER, they say no, absolutely not. Like I don't want my data to be used in that way. Sorry. And it was a model that was shelved. Unfortunately, it was a very successful model for the data that we had. And in BC, for example, we have patients as partners, that like that those type of like mechanisms where we actually hear from patients, and I think we should make use of that, and we should make use of that at scale as much as possible, because at the end of the day, like they're receiving that service that is being provided.
Right. Systems of care would say you have to think about the people who are actually receiving that care. And I'm glad to hear that it looks like everyone here is trying to make those efforts, which is awesome. Now we're coming down to the end of our discussion. There's more questions in the Q&A, and what we'll be doing is working to address those with people who've got them. So we're not going to leave you hanging. But I do want to give just 1 minute to everybody to at least wrap up their thoughts or maybe suggestions about AI and moving forward. So I'm going to start, if that's okay, Brian. I'm going to start with you to just give us a 1 minute of what you can see or what you would tell people who are healthcare leaders about AI and the things that you think they might want to focus on. And then I'll go to Oz and we'll wind up with Sheazin. So over to you, Brian.
I don't know if I need a minute. I think I just firmly believe that there is no future in healthcare that does not involve the use of AI. And we're using it now, but maybe more specifically even the Gen AI, because I've seen what these things can do. And so again, approaching it with that mindset, instead of thinking, well, maybe we can defer this 5 years, maybe I can retire before I have to deal with this. No, it's coming.
It's coming.
So get ready.
I think you're saying it's here actually, and we're dealing with it right now.
But it's not fully embedded in the way that it could be, and it's not being used to the extent that it could be. And I think so last thing would be that you're recognizing that other industries have done this. We're coming late. This is not new. So again, kind of that motivation, that push to get us over the hump.
Yeah, absolutely. But to give the healthcare credit, my sense is it's a complicated industry with a lot of stakeholders in place. It's not the easiest place to innovate. So that's why Sheazin and your work and all the work that you guys are doing is really it's actually inspiring to see it, because even with those constraints, there's still a good amount of movement forward. So Oz, maybe over to you to your thoughts. And
absolutely. I think Brian already covered the urgency anyways, but I think also the literacy, understanding what it can do for you, so that you actually can embrace it during your day-to-day, during your professional life, and across the system. I think that will be the key. At the end of the day, like buy-in is the most important thing in my mind anyways. As leaders, like we need to start. We need to start, like as Brian says, like this is not, there's no future without AI. So we need to start, and the best way to do that is like train ourselves. And to this date, I'm a data scientist, but I am trying to learn like, oh, what does embedding mean? What does this mean? so we need to train ourselves. We need to understand what it does, what it doesn't do, and what are the risks, so that we don't fear. We brace it. We brace for the risks, but we also embrace the opportunity.
I'm glad I heard education is going to be a part of the solution. That always makes me happy as an educator. But Sheazin, it looks like you're going to get the last word, so I'd love to hear from you.
I think it's really building on what Brian and Ozge have said. It's look, a lot of people let's be kind to ourselves. A lot of people are working hard to understand and learn AI, digital transformation. AI, I think, is the end goal of creating a learning health system. It makes us smarter as well in how we deliver effective care. And I talked to my team. I said, it's kind of like toddlers learning to skate. it can be cute, but there could also be some small disasters that can happen. But keep learning. Don't quit. And do a self-check on yourself. Are you coming with an opinion, or is this something that you really, you're curious about, and you're experimenting and you're learning and adapting to leading trends? Have that growth mindset. I don't think anyone globally can say they know how to do this. Absolutely. Even the global thought leaders are learning and continuously learning with humility. And I think the end message I want to say is have fun. Like, this can be fun too. And we're all in it together, and let's come together and do this.
That's a great last word. So I just want to just take the last thing to say thank you so much to Brian Simmers and Sheazin, Premji, and Ozge Uncu. We are very appreciative of your time, and thank you so much to everyone in the audience for their discussions. Have a great day, and thank you very much.